So, Wendy, if I walk into your clinic and you have diagnosed me with osteoarthritis of the knees, what are my treatment options?
Okay, well, if we're talking about medicines, there's lots of different things that we can try. So first of all, if it's your knees, a good thing to try is rubbing on some anti-inflammatory cream. So for example, ibuprofen or diclofenac cream are quite good to rub on through the skin, and medicine can pass through the skin directly into the joint, and that is safe, and you can use that more or less for as long as you like, and most people can continue that medication. Moving on up from that, taking anti-inflammatories by mouth can sometimes be useful, but you should probably limit those to the lowest dose for the shortest possible amount of time. Sometimes simple painkillers, for example, paracetamol, can sometimes be useful, although recent guidelines don't necessarily support the use of long-term paracetamol. They may work for you. And then moving on up from there, it's going to be stronger painkillers by mouth, which are not usually recommended for osteoarthritis. For example, codeine-based medicines.
They're quite as strong
Yeah,
ones.
stronger ones.
Now you have diagnosed me with inflammatory arthritis. What are my options?
Well, inflammatory arthritis is a condition where the immune system has gone wrong. So we are going to need to give you a medication that basically bashes the immune system back. So there are lots of different options for that. So we can give you some short-term help with bashing the immune system, either with an injection of some steroid, which can go either into the joint or into your bottom, which will work all the way around. Sometimes if the arthritis is really severe, you may be asked to take some steroid medication by mouth, but that's very much a short-term option.
To dampen down that fire, isn't it?
Exactly, firefighting, that's what that's for. Longer term, we're going to need to control your immune system in a more gentle and controllable way, but with something that we call a disease-modifying drug. So that is something that will actually affect the immune system and calm it right down so that you will feel a lot better. And these are drugs, for example, that you may have heard about. So, for example, methotrexate or sulfasalazine, and these will be taken regularly to calm things down, but they can take about 3 months to start working. For that reason, you may need to continue with your other pain-killing medications for several months while those start working.
What about if the first-line medication doesn't help me at all?
Okay, so now in about 1 in 10 people, conventional medicine will not be effective and you will still continue to have swollen joints. In that case, you will be offered something called a biologic medication, and these are more advanced treatments to control the immune system, given either by an injection that you can learn to do yourself, or an injection that's given in the hospital, or more recently, a tablet can also do the same job.
Why are GPs stopping patients' pain medication for osteoarthritis?
Yeah, that's a great question. It seems a bit unfair, doesn't it, that fact? So what's happened is that NICE, who are the organisation that decide what treatments are recommended for certain conditions, last year in 2022, came up with some new guidelines for best management in osteoarthritis, and they've looked at loads and loads of research that shows that most painkillers that we commonly use, like paracetamol, codeine, tramadol, don't work for osteoarthritis. So many GPs are now starting to reduce these medications. Even worse than the fact that they don't work is that they're very, very addictive. So that's another reason. However, clearly medication that you've been on for a long time should be reduced slowly and not be reduced suddenly. These guidelines are really interesting because what NICE have said in osteoarthritis is that self-management is the most important thing.
This is exactly what we are offering.
Exactly what we do, especially weight management, which is vital to protect the joints. Exercise, especially directed exercise, especially to the lower limb joints. And looking after yourself. So self-management is now considered to be much more important than any conventional medication in osteoarthritis.
And I guess that learning about the condition helps as well. Right?
Absolutely. The more you know, the better position you'll be in.